The impact of stress at delivery. I do not hear people talking about this a lot, but as a labor and delivery nurse, it's something that I saw both on mom and baby that we really need to talk about. Now, you guys are going to say, of course, delivery is super stressful, but I'm here to say that it can be done in the right way and also the wrong way. So keep watching. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to get you prepared, not scared, or should I say best, not stressed, for your upcoming hospital birth. Now, there are a lot of people online who just say they muscled through labor and delivery and then the baby came out and they felt like, yay, I didn't get an epidural. Now, for a long time as a labor nurse, I thought, great, good for them. They could muscle through. However, the longer I did labor and delivery and I watched the babies who came out of those moms, I started to notice something. Now, during labor and delivery, most everybody's a little bit stressed, right? It's a lot going on, a lot of pain on our body, a lot of stress on our body and strain on our body as our uterus contracts to get that baby out. But some people take that stress and they're really able to cope with it. Now, a lot of this, you're going to hear the word coping with it. What is coping with it? Well, it's when you're able to manage the pain, because some people do not cope with it. They start to freak out. And as you can imagine, when you start to freak out, you start to pump these stress hormones into your body. And this little baby that is in your womb is not immune to those stress hormones. It starts to pump into this baby as well. And when they finally come out, they are tired. Think of those images of people who have just finished a marathon and they lay down and they're like, I am so done. We do not want your baby to be doing that when they come out of the womb. They need to have the energy to cry, to get the amniotic fluid out of their lung as they transition to live in this air-breathing environment with the rest of us. So one of the things as a labor and delivery nurse is for us to closely monitor if you are coping with your labor or if you are not coping with your labor. Now, I hear a lot of people saying, I don't want them to offer me pain management at all. But I gotta say, as a nurse, as I start to notice that you are not coping with the pain, I will likely ask you how you're doing and if you would like an epidural or something for the pain management. I have a whole video on the pain management options that you guys can find up above, because coping with the pain is really important both for you and for baby. As you can imagine, having those stress hormones pumped into your body is not great for you either. And in the United States, we have poor outcomes sometimes on people's hearts. So we don't want you to be so stressed during labor and delivery. It's just not good for anyone. So how do you cope better? How do you not get stressed at delivery? One of the first things is to engage your partner. They are going to know very well if you are coping with something or you are not coping with something. For instance, my appendix burst last fall, and my husband knew very well when it turned from, I'm doing okay with this pain, to, no, we really need to get her to the hospital. She is no longer coping with the pain. People who know you can really easily tell if you're coping with something or if you're not. Now, some people find just the hospital environment extremely stressful. Some of that may be due to past trauma. Let's say your dad was in the hospital or you've had a poor experience in the hospital before. And some of it may be due to just not understanding what's going on in the hospital. I gotta say, at the last hospital I worked at, we had the most difficult faucets to turn on, which was so dumb. And I always felt so bad because I felt like the hospital is hard enough. We do not need to be making it harder by people not even being able to figure out how to turn the water on after they use the restroom. But I gotta tell you, sometimes hospitals just are not created to make things easy, unfortunately. And people can be really stressed out by just what's going on in their body. It doesn't feel normal or natural to them, which is how they thought labor would be. They thought it would be very natural because everyone has babies, right? And I will be the first one to tell you that most people do not feel like labor feels normal or natural. It feels like they are being tortured, and that's not what we want you to feel like. Now, when you understand the stages of labor, you understand what your body is doing, that can make it a lot easier. When you understand what's going on in the hospital, that can make it a lot easier. I like to call it the scary stack. It's when we are just slowly putting books on your hands as they're outstretched, and after a while, they are really hard to carry. But when you only have a couple books put on your hand and you understand everything else, you can put everything else down. You know why the gown goes on in the back. You know why 5 labor nurses came in your room. You can put a lot of those things down down and just told a couple of things, which is pretty easy to handle. Now, if you're thinking, Hillary, I would really like to not be stressed at delivery, I would like to understand what's going on, I am here to give you the solution to that problem. The online prenatal class for couples was created to get you prepared so you would not be stressed at delivery. It's going to help you know how the hospital can help you manage pain, but also give you the options of natural pain management if you can do those and cope well with them. And it's going to involve your partner so that they can really help you cope with the pain rather than just sitting on the corner, thumbing through their phone and watching TikToks. And yes, I have 100% seen that. Do I like it? No. But partners need to get prepared too. This isn't innately coming in them either. That birth class is budget friendly. That's right. I see a lot of the classes on here heading to $400. That class is not in that price range. It is created by an unbiased, evidence-based expert who can really help you understand your upcoming hospital birth. And it's very doable. The main class only takes 3 hours, so you can really get it done and get on with your very busy life. Because the last thing we need is to prepare for birth, and that is stressing you out too. So take a class that you can easily do. I will put the link for the online prenatal class for couples down below. Now, have you taken a birth class? Have you not taken a birth class? Tell us down in the comments. I actually have some of my favorite birth classes that you guys can check out in this video right there. Because I do not want you stressed. I want you prepared.